Hello everyone, my name is Heather Esquivel. Welcome to my presentation discussing the use of dance movement therapy, DMT, in the treatment of mental illness and the need for this program to be introduced and implemented into public elementary school curriculum. An overview of this presentation is displayed here. I will introduce the topic, discuss what DMT is, how the humanities and the social sciences intersect with DMT, what is required to become DMT certified, the present uses of DMT, the prevalence of mental illness in young children, integration of DMT into elementary schools, opposition to implementing the program, and the closing remarks. Awareness for mental illness has grown significantly over the years. This is a human issue that needs attention and solutions. Dance movement therapy is a fun, interactive, holistic approach to treating and hopefully preventing mental health issues, specifically in young children. What is dance movement therapy? DMT is a therapy designed to allow individuals in a group or a one-on-one setting to express themselves non-verbally through movement. DMT started in the 1940s in mental health treatment facilities and showed promising results. This specific type of therapy improves self-image and helps teach communication and group interaction skills. How is DMT intersected with the humanities and the social sciences? The arts are frequently interconnected with the social sciences. Often we hear about mental health professionals advising their patients to take up things like painting, journaling, or anything that helps them relax. The arts help humanity enjoy life. Dance is no exception. Dance therapy connects the body with the mind, relating the humanities to the social sciences in the form of psychotherapy. This form of therapy allows a person to express their inner selves through outward motion, releasing endorphins that make us feel good. DMT education and certification. Now that I've hopefully piqued your interest, it's important to know what it takes to become a dance movement therapist. According to Berkeley, working as a dance therapist generally requires an undergraduate degree, in addition to a master's degree or postgraduate program approved by the American Dance Therapy Association. These professionals are trained to identify and address trauma and mental health concerns by observing nonverbal movement. Ideally, it would be beneficial to have a couple of additional staff members in elementary schools to be specifically trained or certified as a DMT therapist. Uses of DMT. There are numerous uses of DMT. There's a significant amount of research available showing the success of DMT with physical ailments. But it seems in recent years there has been more research directed towards the use of DMT with mental health illnesses and trauma. DMT is effective across cultures. Eileen Serlin, a psychologist and dancer with many years of experience in her profession, considers the arts a tool for healing. Eileen stated, "The arts provide symbolic, nonverbal ways to work with unspeakable trauma, natural and man-made disasters, dislocation, and caregiver burnout." This picture here, titled Resilience in Istanbul, shows one of Serlin's DMT classes. The patients she works with have all dealt with trauma. In addition to Serlin's positive results, there are numerous other cross-cultural studies that show the effectiveness of DMT. Froggatt and Little conducted a study in the United Kingdom using DMT as a form of therapy for mental health issues in a hospital setting. The participants, referred to as service users in the study, had an overwhelmingly positive response to the program. Dancing physically and psychologically relaxed the service users. Being part of a group appeared to have some therapeutic benefit for them. And dance also enabled them to transgress the boundaries of the self, with some participant responses being, "I just get lost. It takes me away." So at this point, you're probably thinking, okay, cool. DMT sounds great. Blah, blah. Sign me up. Well, let's go a bit further with dance movement therapy. We have all heard about, been friends with, or been the person who needed a little extra help as a child, who needed a little extra attention, a little extra love, care, and concern to help guide them and make them feel as though they were wanted and worthy. This brings me to the topic of mental illness in children. A significant number of young people globally, 10 to 22%, have a mental health disorder depending on the country. It is important to note that these children with mental disorders face major challenges with stigma, isolation, and discrimination, as well as of a lack of access to healthcare and education facilities. They are being left behind. What happened to no child being left behind? Prevention. Knowing that mental health issues are significantly impacting youth globally should make people want to find solutions to the issue. So let's think about it. What helps in treating mental illness that does not require medication and can be implemented on a large scale? My answer is dance movement therapy. Physical activity reduces the development of mental illness and serves as a non-pharmaceutical treatment for people with diagnosed mental illness. It releases these endorphins that make us feel great. My proposal is to have DMT integrated into the public school elementary curriculum. Why should DMT be integrated into school curriculum? Bonnie Bernstein, a DMT therapist with over 40 years experience, stated, "Early developmental steps, usually shaped by family, early relationships, and successes through school experimentation help build a child's self-confidence and trust in their competence. When these supports are lacking or overshadowed by trauma, uncertainty about intelligence and abilities may lead to the establishment of an insecure self-image that lasts through adulthood. To prevent this from happening, early prevention is necessary." This early preventative measure not only helps to identify and treat mental illness, it helps to build a better society with secure, confident adults who have learned how to cope and handle with tough issues early on in life. DMT conducted in a group setting provides a non-judgmental atmosphere and supportive togetherness as a safe platform. The enjoyment and empowerment in dancing gave rise to acceptance, trust and ability, and emotional expression. There's much more participation in programs such as DMT when children are young and receptive to instruction without being so easily distracted and influenced by their peers. Mental health services integrated into students' academic instruction showed stronger outcomes than services that were not integrated into academic education. Opposition. Of course, with any proposal, there is opposition. In this case, I can foresee issues with getting the program federally funded. To get federal funding and approval for a program like DMT in schools would be a very lengthy process. Two other forms of opposition I could see being presented is an argument being put forth about the effectiveness of DMT, in which I would counter with statistics, and the third, and probably the most important, would be about participation. This is why I would like for DMT to be introduced early before kids start developing that need for peer approval. In closing, let me remind you that 10 to 22% of the world's children suffer from mental illness. This is far too much. When will we start caring about the well-being of humans, of children? When will it happen? I propose for us to make it happen now, to take a proactive approach to identifying and treating mental illness rather than stating later, "I could see that coming," from his or her behavior. DMT won't fix everything, but if it can fix some things, if it can reach out to 1 child, 2 children, 3 children, it is worth trying. Thank you all for listening to my presentation.